So this is Dr. Phil Mollica, our last presenter. He graduated, well actually, first he got his master's degree in human anatomy at Farley Dickinson University. Then he graduated from the University of Medicine and Dentistry in New Jersey, 1983. He's an author, researcher, speaker, and he's on our board of directors. And he'll talk about a school he also hosts. Dr. Phil Mollica, good friend of mine.
Thank you, thank you. Hey. All right. Well, who's new to our academy or who's visiting the first time here? Awesome. Welcome to the family. I hope I don't ruin your afternoon, but I'll try. Okay? We're going to have a good time. So listen, first thing, obviously, since this morning and this afternoon, we know what? Mercury fillings and fluoride what? Suck, right? Oh, my God. So that's, so we know we have to, eliminate those things. We like to eliminate them. We have discussions with our patients. But who wants to be or who wants to evolve into a biologic dentist, right? Are you all biologic? Okay, what the hell does that mean? And that was my biggest question. I went, after dental school, I stayed around for a residency in orofacial pain, which was cool, very allopathic, orthotics were the answer to everything. And then it evolved into, what was the best drug that could numb you? Okay, Tegratols, Neurontins. I'm like, what the hell am I doing here? I did all these board certification. I'm sitting here. I'm just putting Band-Aids on. Like my daughter's a nurse, and she said, she works at a major hospital. She's a COVID nurse. She's gone through that whole thing, and thank God for ozone. That protected her through this whole process, and vitamin C and all those other little cool tricks. But she said, we're at the hospital. My lecture's over. Thank you, ladies and gentlemen. And, oh, it's back. Ah, darn. She says, in the hospital setting, we put Band-Aids on people. And then when that Band-Aid fails, we put a bigger Band-Aid, and a bigger Band-Aid. Until what? The Band-Aids just don't work anymore. And you slip into that great abyss. And allopathic medicine's important. But, Mike and I went to Capital University of Integrated Medicine, got a doctorate in integrated medicine. That really opened my eyes, too, to a different world, Because in reality, we have the innate capacity to heal ourselves. And we're always in the process of really healing. And by the work that you're doing, especially in dentistry, which has been such a linear allopathic model. Remember dental school? Like a herd moving across, okay? In our world, okay, and we welcome you to our world, we like to think a little bit differently. That's for sure. But you know what? It makes such a difference in the way you practice, the way you think, and the outcomes of your patients, and that's for sure. So, why are we here? And that's the ultimate question. Why are we here? Well, for me, which is important, here and at our school that we run, first of all, the goal one is to feel good and have fun. Right? And you're all having fun right now? Do you feel it? I feel it. Okay. So we're having fun, we're learning, we're sharing our experiences. And this is what's great about this academy. Beyond the great lecturers and speakers that you'll see over the weekend, this group is rare in dentistry in that they share so much. We're like one big happy family. Right, Janet? Important back there. And, they're very willing to share and mentor you and bring you into our world, which is really, really great. But also, how do we define ourselves? And this is one of the interesting things that that kind of like made me think about it, because, oh, you're a biologic dentist. Oh, yeah. Well, what are you? Oh, I'm a holistic dentist. Oh, okay. Oh, what are you? I'm a physiologic dentist. What the hell is that? You put a whole bunch of dentists over here. Oh, I'm biologic. What the hell does that mean? How do we, once again, how do we define ourselves? What the hell's a biologic dentist? I don't know. So we went into that and started to develop, basically from almost Capital University, the concept of integrative medicine. We evolved and reworked it in a dental model. Because integration, as we'll get into it a little bit, is really important because we have to have an open system because patients need different things. And we have to be open to those different things and understand what these patients are doing today. I mean, you have patients coming in doing a multiplicity of all kinds of things. You ask them, well, you're detoxing? Yeah, I says, well, how you doing that? Well, I saw it on the internet. I go, okay. You know, doc, you know, what do you think about colonics? Okay, that's fine, no problem. Okay, so the basis for that, and really the essence where I'm bringing you today is, we want to think really in a biologic manner. And that's really the paradigm shift. Because all the technical stuff, you know, I'm not going to reteach you how to cut a prep. You know, you got the idea of taking a hunk of mercury out, all the precautions, all that kind of, that's all the mechanics of dentistry, and you guys are experts in that area. But when you think differently, it's a whole energetic shift. And your world as a dentist changes, plus also your patients change. For the better, believe me, for the better. And we'll kind of explore that. But what the goal for us is really as a group, and a lot of the, you know, faculty that we have with the school and just fellows here, you know, we try to develop a coherent model. I mean, how do you work within some kind of model or parameter that would define you in the biologic sense, that you can define yourself as a biologic dentist? And we came up with what's called integrative biologic dentistry. Okay, we'll define that. In our world in dentistry, once you shift into this model, you kind of, once again, thinking differently. So, you know, when you look at patients now, I mean, is this a local and a systemic problem? These are far-reaching implications. You remember dental school? The body just happened from the neck down, or really from the jaw down, happened to be some dragging a head around. Nothing existed below the jaw. And the reality is, a lot of disease states, a lot of the problems, hold up for detoxification, cancers, all these things we see today have a lot of origins in the oral cavity itself. I mean, we're seeing things today like osteonecrosis of the jaw. How the hell do you deal with that? You know, antibiotics will do the trick? No, the initiation thing is bisphosphonates. Remember those? Those are popular. Okay, Zometa, you know, Fosamax. Oh, my bones are feeling so much better. I'm on Fosamax, but I stepped off a curb and I broke my leg. Okay, or I bit into a Cheetos and now my jaw fell out. Okay, well, how do you deal with this? Would an antibiotic or a medication fix this? No. What's the biology behind that? And how can we help the patient help themselves to heal? What's going on? We have vascular collapse. We have a microflora that's totally disrupted. Those poor epithelial cells don't know what the hell they do. We've got a hunk of dead bone sitting there. But through integrated processes, bringing different aspects of medicine and dentistry together, we can support that healing process and ultimately remedy these situations like this. I mean, think about this. This is when I was working with ozone on bisphosphonate cases, okay? This is, I showed this picture for years, but this is a gentleman's maxilla. This is, I don't know if they have a laser on this thing. Or maybe they do. Oh, they do, green. This is the floor of his maxillary sinus. Here's the maxilla, okay? Poor Harry comes in one day, I'm working on this case. This is what happened when you do a radio show, friends of mine. Well, working with ozone and doing all kind of cool things, these integrated approaches to help with these bisphosphonate cases, okay? And they were cropping up all over the place. And he comes in and we're working with him, doing ozonated water and infusions, drainage remedies, all kinds of cool stuff, vitamin C, hyperbarics, everything, trying to fix this guy. He's been on antibiotics for 6, 7, 8 months, so your immune system is shot, okay? So one day he comes in, Harry, how you doing? This guy had pus pouring out of his mouth for months. We're gaining control. This is early on. And so one day, I'm there, start off, of course, irrigating ozonated water with all its beautiful properties. And I go, this bone was kind of sticking out of the gum. I said, you know, did that bone just move? I go, I says, Harry, the bone's moving. Oh, yeah, Doc, I forgot to tell you. That's been moving for a few days. And I'm like, okay, now what? You know, what do I do? Yank on it? Leave it? Okay, let's yank on it. Yank it, boop, plopped out. That big hunk plopped out, plus I have a bone jar of all bisphosphonate cases. But as I learned over time, there we go. This was part of the healing process. The body's in its innate healing capacity got rid of that crummy dead bone. And once it did, after I had a heart attack over it, okay, and it was all of a sudden we continued our therapies, And this dysregulated tissue, which means bad information, blood can't get in, lymphatics aren't working, all this, started that beautiful process, broke through that barrier, and started to heal where the tissue became regulated and started to function and heal itself, okay? So role as a biologic dentist, of course, is support the patient's innate healing processes. Okay, we're not going to force ourselves, I will heal you. No, we're supporting that process, but thinking biologically, what are the things this person needs to support that particular process itself? So basically, it's, the gold CAT scan there, the ICAT, went from that raggedy dead bone, basically a hunk of bone, and I was able to work with all surgeons down at the University of Miami. We're able to make a little buccal flap, and Harry's in a partial today, doing fine. We're not putting implants in there, I don't think, but but we'll pass on that. And but thank God, and I get my cheesecakes from Manhattan periodically. Hey, life is perfect. Okay. Cases like that we're seeing today, Lyme disease. I don't even know what the hell Lyme disease is anymore. Used to be, well, a tick sucks on you and spits in you, and you get this Borrelia and all this kind of stuff. Now it's all these co-infections. So what is this thing, okay? But we're seeing where you're having people are having extractions done. They're not healing. These extractions lay around forever. They become infected. And these bugs love to hide out. Listen, dark, wet food, life is beautiful. You just can't heal. In these cases, it's a very acidic environment with this extraction done years ago. I can go in there, excavate it, and try to hope, PRF, all kinds of cool stuff. Or what we did in this case, we used ozone. We get in there, and all the properties of ozone, which we have time we'll talk about a little bit. But here, we changed the ecology to allow for the healing process to go, okay? Elevated the pH, because you can see the factors of healing is that, remember, bone cannot remineralize in a very infected or a inflamed environment. All the minerals that would remineralize the osteoid are what kind of charge? A positive electrical charge. These type of infections are also what? Positively charged. The minerals can't get back in. So watching, that's why when you see, remineralization, these healing of these lesions, there's no infection or inflammation. Simple biophysics. So we do our ozone, get on some drainage remedies, all the different tricks, and we can get nice healing of bone. By changing the ecology, supporting the patient's, once again, innate healing processes themselves. So we can see here where, we even got a naughty little root canal out of there, which was fractured and creating problems. So supported that healing process. But today, man, we're seeing weird stuff. Case like this, I worked with a friend of mine, Lou Travato. Patient winds up, getting squamous cell carcinoma of the maxilla. Winds up getting massive surgery. Okay, takes the maxilla out, the sinuses, all this kind of stuff, and he's not healing. And the physician said, well, you know what, you're alive, but you can't heal, radiation therapy, etc. So how can we, once again, get blood flow back to there? How can we help detoxify, help support the healing process, get those epithelial cells up and regulating again? We need information to get to there themselves. So you can see all these type of wounds. You see an obturator here on this gentleman itself. And I said, well, listen, nothing to lose. Let's see if we can help him. So once again, thinking biologically. Here's the tissue inside his mouth. Paradex's just not going to do it, by the way. Okay, you can rinse it, the cows come home. There's biologic damage here. So in cases like this, basically microwave tissue. The blood vessels have collapsed back. You're not getting the immune system regulating in there. The epithelial cells don't know what the hell to do, and we'll discuss how that's regulated. So what can we do? Well, this is where we took ozone and other remedies together and started to circle the dragon, try to reestablish circulation. In the world of osteopathy, what rules supreme? The artery. You need blood flow in for the healing process to take hold. And once again, no matter how old, and remember, age is not a disease, right, Mike? There you go. But you're not too disease-ridden. But once again, how can we support this process itself? Well, there's a whole trick to these type of things that we found over time. Where you see here, we started using ozone therapy, other remedies, good nutrition, good hydration, good clean water, okay, all these different remedies. And you can see on the upper right here, we started to establish the vascular beds are opening up. I mean, I'm getting hung up on ozone too much, but ozone, when you infuse it, it creates also tons of what? Nitric oxide. And what does nitric oxide do? Opens up the vascular beds. And that's critical, okay? And once again, we can see here how the healing processes go. So all we were doing as biologic dentists is supporting this patient's, once again, innate healing processes themselves. And you can go from this damaged tissue to that, and that to that. And that's pretty damn good. Well, no, these are direct infusions. With ozone, I want to go for it. We can spend hours on it. But here, you just take ozone gas at a certain concentration and what we call circle the dragon. Okay, peripheralize around there. And then you see the vascular beds just open up and the blood start to flow. And consistent, putting them on ozone water and also ozonated oils to get that healing process going. Amongst other good things that he was doing nutritionally, you have to have the nutrition component and the hydration component. You know, typically in our biologic practice, I work with my dear wife. She owns everything. I just work for her. She's the boss. And, you know, one of the first questions, we ask them, how much water do you drink in a day? You know, I have a cup of coffee. No. How much water are you drinking today? I have a cup, maybe 2 cups of coffee. Why do you have those headaches all day long? You know? So we get them on good hydration. And water, we can spend another whole day on, which is very fascinating. Simple molecule, but incredible thing. Okay? So infections, you know, of the head and neck, of course, has far-reaching implications. So when we were examining patients, we were seeing infections in the jaw, infections in the soft tissue, and infected tonsils. Even if tonsils have periodontal disease, infections in those jaws, their tonsils are infected also. Well, I had my tonsils out. Well, they debulked the tonsils. Remember, those tonsils are still stuck in the pharyngeal wall. So this whole ecology is infected. And by the way, the body doesn't know, you know, different parts of it. It knows itself as a whole thing. When all those bacteria, virus, fungus, who the hell knows what you grow? Everybody grows different things. By the way, they're pooping and peeing in you. And that's what gets you, not them. It's their metabolic byproducts. Those are the toxins that create, you know, thrombotic issues, toxicity, inflammation. It's not cholesterol. Oh my God, cholesterol is going to kill you. It's the chronic inflammation. And cholesterol is a low-grade antioxidant. It's the inflammation in your body that finishes off. So once again, on the next slide, of course, you know what factors cause whole body inflammation? A lot of infections from dental origin. It always amazed me for years, physicians, they're starting to become somewhat enlightened, is that they always go, oh, look at the tonsils. Oh, they look good. You just passed a toxic sewer dump. Root tips, you know, disease, you know, wobbly teeth. That's okay. It's only teeth. Oh, my God. Okay. Why did they have a couple of heart attacks and strokes? Well, we know, especially with, you know, like things like chronic periodontal disease. You talk about periodontal disease, it eventually evolves into what? An autoimmune disease. You know, and I'm going over this again, but, you know, 90% of you is what? Bacteria, which we've been trying to kill for what? 50, 60 years with antibiotics? Instead of nurturing it, which is critically important, you know, a happy commensal microbiome in you is a representative of your health and wellness. When it starts to shift and becomes nasty, some types tend to emerge depending on the ecology. That's what we call infection. They're opportunistic. When the ecology changes, bacteria have great propensity for shifting genes on and off. They can change all day long. It's called pleomorphism. Mammal cells have a real hard time doing that. We have to work at screwing ourselves up. But bacteria, as the environment changes, like for the oral cavity, becomes less oxygenated, more acidic. The bacteria going, hey, that's okay. Throw a switch. I can do better. Oh, it's getting nastier. Ooh, maybe I'll become a spirochete. Ooh, really screw you up. Okay? Till eventually they get so packed in there because you can't clean your damn gums out if people are not doing their oral hygiene. There's not enough room. He says, man, I'm going to kill all my damn neighbors. You know, it's like that crazy movie, once a year you get kill everybody or something. So they hijack what? The neutrophils. You know, poison them, and they go berserk and kill everybody and dump enzymes and so they can all escape into the tissue. So they're hijacking our immune system and left to their own accord. And we can see in studies, you know, once again, I mean, we're seeing these far-reaching implications, you know, where knees are infected. I mean, for a while, these prosthetic hips and knees and whatever were failing. They're like, what the hell is going on? Well, by the way, you didn't send the patient to the dentist to get cleaned up before they went for this great surgeries. And they failed. They did all kinds of wonderful studies and found, wow, there's bacteria from their oral cavity here. There are no barriers in the human body. You may think there is because we think in terms of pieces and puzzle, okay, a little piece here and there. It doesn't work that way. Gravity sucks. Everything drains down from your head. Murder, okay? And we see today, of course, you got to be on something. You got to be on drugs, right? You need drugs of something, you know, for your cholesterol, for your heart, for your liver, okay? But how about the side effects? Take this drug, you can sit in a nice tub on a cliff, but your liver will rot out. You will die, but the lawyer will take care of your family for you, okay? So we see the side effects of these drugs. You know, drugs, aging, dehydration are affecting these things we're seeing today. And we all see patients come in, they're taking all these pharmaceuticals. They're like, oh my God. They're taking pharmaceuticals, they're seeing side effects of pharmaceuticals. When they get off of them, wow, I feel so much better. Drink a glass of water. So unfortunately, we see the side effects of all these medications. They all have side effects. You know, even some of the stuff we do with root canal, sodium hypochlorite, we see these injuries. The Clorox, which is chlorine, which has never been FDA approved for use, spills out of a tooth, burns the hell out of the patient. You know, Boniva, Fosamax. It's great, okay? It's a fake. Those are actually chemotherapy drugs that were developed years ago that happen to be really cool. Wow, look at that bone density to prevent cancerous invasion of bone. Wow, let's use it off-label for osteoporosis. Dumb. That's a nutritional issue, okay? So we have to deal with these side effects, and we're seeing that. I mean, these situations become extreme. Once again, bisphosphonates, wow, beautiful, you know, 4x4, 6x4, and boof, you know, implants are open systems. Ecology shifts, pharmaceuticals suppress the immune system, your bone ecology changes, and you wind up with traumatic issues like this. And I got to tell you, you know, dentistry is complex. I mean, you're all in this world. Somebody comes in, I think it hurts over here. Okay, what does that mean? Is it hot or cold? No, it just aches once in a while, this and that. The tooth looks okay. Could it be a referral pattern from, you know, a meridian? Could it be, you know, joints, muscle pain, ligaments, periodontal pain, nerve pain? And usually a combination of different things. So, you know, in head, neck stuff, it's not that easy to diagnose. But, you know, when you think about human diseases in general, okay, we have infectious diseases, okay, hereditary diseases, genetic and non-genetic, nutritional deficiency diseases. I mean, our food supply is a little weird these days, okay, to say the least. Physiologic diseases and communicable and non-communicable. I think we've been in a communicable phase, or have we, okay? So we come out of our little COVID world, okay? But people dealing with these chronic health issues, we see chronicity today. People are living longer. Are they living better? Some are. But a lot of them are living with diseases, okay? Chronic diseases that are being controlled and maintained. But infections, once again, from dental origin, have a major, major influence on the outcomes on these patients themselves. So when you think about infection, which is when you break out of colonization, some little weirdos take over, the ecology shifted. All of a sudden, these little nasty bastards come out, and you're raging this infection. It could be chronic, whatever that means. It could be acute. And, of course, bacterial, viral, fungal, parasitic. Okay. We should worry about parasites in dentistry. Oh, yeah. Oh, yeah. See those amoebas coming out? Ooh, trichomonas. Oh, my God. Okay, or, and it's usually a combination of things, okay? I work with a lot of microbiologists in ozonated water around the world, and it's interesting with microbiology. We know less than 1% of all the microbes in the world. We don't know much about them. And even in the oral cavity, oh, it's this, and this. But, it used to be when I was in dental school, well, there are 4 bacteria in your oral cavity, okay? Great. A few years later, now there's 10. Now there's 20,000. We don't know what the hell grows in there because everybody's different. By the time you harvest things out of the environment, 90% of it's gone. It's great in there, but you take it out. By the time you titer it, you don't know what the hell's there. Even all these great tests, DNA tests, all this stuff, it's only testing a super sliver what's there. It gives you a sense, an assessment, and a sense of what you grow, okay? So, of course, with we can deal with acute, chronic, and mixed craniofacial resistant infections. How do we deal with that? Typically, when I came out of dental school, everything, I tell you, the tooth looks a little shaky. Here's an antibiotic. Here's a little gum thing. Here's an antibiotic. We used to take tetracycline, pack it down in pockets. What the hell was that? It was on a little string years ago. I forgot what the hell that was called. We used to pack it down. Oh, fantastic. But how come the bone degenerated? Oh, who knows? So, how do we deal with these things today? And they're kind of different and interesting. And this is where we come up with the concept of the integrative biologic model itself. Okay, we're thinking differently itself. So we try to define this, and I'll pretty have it memorized, but anyhow, really the integrative biologic dental medicine itself, okay? Defined as dental medicine that partners the patient and the dental practitioner to develop and integrate biologically safe, effective, established, and emerging treatment modalities that allows for treatment that is not subservient to any one school of a dental thought, meaning that it's an open system. We're open to all medicine and dentistry. Because most times, patients see you a hell of a lot more than their physician. When they're going to go to a physician, when they're almost like crawling in there, but they go to the dentist. And this is where empiricism and open-mindedness and observing your patients make a significant difference and understanding what they're trying to do for themselves. And a lot of them are somewhat misguided in what they're doing because they read it on the internet. It sounds good. It's like the patient going to the health food store. And they bring in, they eventually say, well, what are you taking? I'm taking so much stuff. Well, who's helping with that? Well, I kind of heard this and heard that. I said, do me a favor, bring your stuff in, okay? And they'll bring a shopping bag of supplements in. And it's like, okay, he's taking 5 pounds of B12, okay, and a couple of pounds of echinacea. I says, echinacea? I says, well, how long have you been taking echinacea for? Oh, 6 months. Okay, you realize after 2 weeks it doesn't work? It's an immune stimulator. After 2 weeks, you get off. Herbs are what? Medicine. It's not a supplement. And this is where they don't know the difference. And this is where you can guide them. Turmeric, all this, you cycle it on and off. Okay? This is where you can help guide them. That's the biologic thinking. In understanding what all the stuff they're taking, how the hell is it affecting them and their gut and their oral cavity? Where does the gut begin? You're right here, okay? As soon as you start chewing, okay, you're releasing, you're releasing all the spit, okay? That's a great lubricant, but it also contains what? Enzymes, okay? Enzymes, amylase, okay, and sucrase, amylase and lipase, amylase and lipase, and what are those? Sugar and fat digesters. Now, enzymes that we all know are what? Temperature dependent, but also pH dependent. Now, if you've got a very infected mouth, it tends to be what? Very what? Acidic. It shuts those enzyme systems right down. But also what's important, this is the problem with getting your tonsils out. Your tonsils have a purpose. You know what they do? They start sensing what the hell you're eating. It's because it talks directly to what's called GALT, gut-associated lymphoid tissue, which is kind of like the brain down below. You know, your gut system has a whole brain, enteric nervous system, because there's so much going on. They got to realize environmentally what's going on. Remember, you know, your gut is an external organ that happens to be what? Housed inside, because you don't want to drag your guts around. Yes, ma'am. Well, you can supplement with enzymes, but also what's important with if you had your tonsils, like I said, if they really took your tonsils out, they would dig into the pharyngeal wall, because it's all connected to the lymphatics here. What you can do, there's a trick called neural therapy. You can actually take Procaine, 2% without any preservatives, and inject those tonsils, and you can reactivate what's there. They're scarred, and you can reintegrate that into your system, and then you'll start to upregulate that system itself. So you can heal them up a bit. You're not going to get that bulkiness back, but you can do some neural therapy on those tonsillar scar areas and rework that. So when you're chewing away, your body's already sensing, your immune system and your gut is already sensing what the hell to do. Okay? So remember, you're the gateway to the environment. Another thing is, it was interesting, is that why do we swallow all the time? Look, to get the spit out of your mouth? Exactly. You learned in our school. You're snipping your environment. You're swallowing the environment so your immune system can sort it out. Am I under an antigenic challenge, or we're okay? Remember, your gut is sensing the environment. You think your senses are touching, feeling, sight, all these different things. It goes deeper than that. This brain here is constantly snipping the environment, constantly snipping the things you introduce into your system. So that's why the oral cavity, keeping it ecologically sound, is significant as far as obviously digestion, ingestion, and environmental issues itself. Okay. So with our integrative model itself, we're open to all kinds of medicine and dentistry. And even allopathic medicine is important. Allopathic has its role. People need different things, and that's why it's important that you start to understand these different healing models that are out there. Because people are doing all kinds of stuff. And they come in, and we'll talk about the woo-woos in a minute, but they come in and they'll test you out. You're like, and you just look like a deer with the headlights on, and say, uh-oh, next. And they're crazy, like us. So in the integrative dental medicine model, really we're looking at holistic, biologic, physiological principles, and mainstream principles. You can't be blocked off anything. I'll never give the patient antibiotic no matter what I do. Okay, that's smart when their head's like the size of a football. Sometimes you need what? Antibiotics. It's okay. But not as candy. But you know what? You learn, okay, you're taking an antibiotic? Here, guess what? I have a nice freezer filled with probiotics. You taking probiotics? Okay, triple them up. Who know you're taking it? Well, here's some probiotics to take home. So they don't have the side effects of typical antibiotic therapy, like fungal infections, diarrhea, all that. It's easy, simple fact. Good probiotics offset those things, okay? Simple little tricks. So in the integration, we bring all those things together, and we're open-minded about that. And once again, these principles, of integrated biological medicine, is applied to chronic and acute infection and inflammation. Okay, we want to control their ecology in a balanced, harmonic way. Okay, because remember, once again, I push to this point. We are but one thing. Your body does not understand different parts of itself. It is one thing. That's why when you do that with that beautiful nerve block, your little toe feels it. It's a whole body phenomena. Okay, you are but one thing. So So many treatments, and we see this, are really chasing symptoms. I'm eliminating symptomology, okay? So what are we doing? Once again, that Band-Aid effect. I mean, you look at the integrative physicians, the true ones, the naturopaths, they're in to try to get to the core issue. What the hell is driving this situation? What element, what component of this person's ecology or environment is creating these cancers, these diabetes, all these different chronicities of disease? Why? What the hell did that happen to them? How can we help the patient heal themselves and make those corrections themselves? So in the integrative world, I mean, other than the typical antibiotics and all that stuff, we have, antibiotics, antifungals, right? Antiparasitics. By the time you give the patient all that, they're cured, but they're dead at the same time, okay? Antiseptics, we use essential oils, homeopathics, laser, ultraviolet light, and of course, oxygen, ozone. So we have a multiplicity of tools at our fingers. Now, maybe you can't do all that yourself, but you wind up developing an integrative team around you of like-minded practitioners that sometimes, you need some Chinese medicine, sometimes you need some acupuncture, sometimes you need homeopathy. You can help your patients in that bind because they're going to come to you as an advisor. And that's why it's so important to understand these models as a biologic dentist. So, thinking about that, I mean, what is a biologic patient? Okay? Well, it's the healthy person. They heard, well, biologic dentistry is great. It's good for you. I got some weird kind of silvery things in there heard were bad. They want to get them out in a proper way. A lot of them come to you with chronic illnesses. And a factor is there, assessing their oral health, head and neck health, okay? Looking for chronic infection, okay, which is critically important. Bad root canals, cavitational problems, mercury fillings, failing fillings, and also replacing things with biocompatibility and restoring health and wellness in that head. So the ill person, the woo-woo. I love the woo-woos. Okay, they come in, they have tachyon beads and foil hats and pendulums and, you know what? Awesome, man. I learned a lot from my woo-woos. And you know what I'm talking about. They're wonderful people. I call them my woo-woos, okay? And the traditional patient comes in, okay? Going back to the woo-woos, a typical example is I've done extractions that had to be done at the perfect zodiac time. I'm sitting there, the patient's I can't take the tooth out till this exact moment. It's like, rip that thing out of their head, or they sit in the car with the pendulum. But anyhow, they're fun. I love it, okay? And the traditional patient, the ones that just go into the dentist. They hear, oh, you're a good dentist. I heard good things about this office, So you educate them about what you're doing, how you doing things differently, especially when they have a mercury filling that you have to take out, and they're not used to being draped head to toe. Like, I never had this done before. Well, welcome to our world. You're safe now. Thank you, doctor. Okay? And, of course, every one of them all have their special needs. And you know what? We love each one of them because you know what? They can go anywhere they want. You have to be blessed that they chose you. Well, sometimes like, oh, God. I go to Pam, don't ever let that person in this office again. I already made her appointment for next week. Oh, no. You know what I mean? So, what are they looking for, too? Okay. Better health, overall health and wellness. A lot of them are great nutrition people. They exercise, do all the wonderful things, which is great. And they want to make sure, and they've understood the importance of, head and neck health and wellness, okay? They're looking for solutions to their chronic issues, Is it the mercury fillings that did this to me? Is it the failing root canals? Is it the bad extractions I had years ago? So they're looking for answers to their chronic illness. Well, it's a piece of the puzzle, okay? We're helping them with a piece of that because there's a lot of other work they have to do. They have to change their total environment. If you're a cancer person, it's hard to reverse that. You can, but you have to be super disciplined. And this is where I've seen successes. And unfortunately, if you have some level of enlightenment, You don't go get chemo, radiation, and all this kind of stuff. You can get stuff cut out of you, that's okay. But then the real trick is that, then you start changing your environment to become a non-cancer person or non-diabetic person. It takes a lot of work. And it's difficult. It's difficult nutritionally. I want that cake. Yes. I want this. Don't do it. Sugar will kill you. Things feed off of sugar. And of course, the cause of, causes related to their general health status, things related to that once again. And of course, they heard it was good. It's great. Get these things taken care of. They feel better. They look better. Okay? So that's all part of that. So, what are they really, really looking for? Well, a lot of understanding. And, we see, Griff Cole does a great, practice management thing for us. And, we see less patients do more and financially make a hell of a lot more money. Some models run, every half hour, one chair to another. Man, dopey. Less patients, more time with them, and boy, you do so much, less stress for you, and you make a hell of a lot more money. So what are they, really looking for? They're looking for understanding, Of course, they want someone who understands biologic concepts. That's for sure. They want to understand that you got an idea about biology of what's going on with them. Understand the different healing systems. Because someone who come in, I'm doing this, I'm Gershon, I'm doing this type of thing, I'm doing all these different type of things, and to appreciate what they're doing. And if you don't understand what it is, they'll explain it to you. And then you do your homework itself, okay? And of course, understanding integrative alternative medicine as it relates to dentistry and as it relates to them. I want to understand that you get it as far as integration is concerned itself. And of course, understanding detoxification. That's a big thing. I'm detoxifying, right? Everybody detoxifies. What the hell does that mean? I'm detoxifying. Are you pooping every day? Oh, yes. Okay, I have patients come in. It's one of our questions, too. Okay, I always say this, I said, okay, you're drinking water, good. Are you taking a poop every day? They look, is the dental office? Well, it's important, okay, because we're looking at their oral health. And, I'm right outside Manhattan, so before we were shut down, we had some, what I call Holly Weirds come out, Broadway people, and, these dancers and stuff. And, well, you poop every day. Well, no. I said, okay. How often do you go? Once a week. Once a week, man, you're full of shit. Oh, praise Christmas, that's not healthy, okay? These are important. You have to address these issues because why is my breath so bad? Well, things are starting to creep all the way back up. You're backing up right to your throat, okay? So think about that one for a minute. But they're detoxifying. It's all different methodologies with that, okay? They're doing drinks, water detoxing, all these different herbal medications, all these different type of detoxifications. So it's important, always ask them, what are you doing health-wise? Okay, what supplements are you taking? Okay, what are you taking? Always ask them about their herbal stuff. I'm taking, they're taking ginkgo. That's always a class one because it's a brain drainage remedy. What it does is it makes the blood flow easier, right? So, okay, we're going to do an extraction today, okay? Take the tooth out. What the hell? I can't stop the damn bleeding. Did you take an aspirin? No. Did you take some supplements? Did I tell you I had ginkgo today, the ginkgo thing? Oh, great. Willow bark? Oh, great. Okay, it's aspirin. Why are you bleeding? So always ask about these things because a lot of times they don't connect, these things to what you need to know itself, okay? So detoxifications, and there was another thing to ask them. And, understanding biocompatibility of dental materials. We're down to, one company, Clifford Reactivity, went out, but, sometimes the patients want to have the biocompatibility. Like Joe Palmer said earlier today, I have a repertoire of materials that I've tested for years that I think are great, but certain patients want that testing done. Fine. Here's the kit, let's do it. And check it out. But appreciate and understand that and explain that to them, what that means itself, okay? And of course, foundational nutritional concepts. What are they doing nutritionally? What can you recommend that might help, okay? Give them some ideas, or be able to refer them to an integrated practitioner, not your typical dietitian who has the pyramid upside down or something, okay? Very, very important, so understanding that. And understanding the supportive therapies that you're doing as it relates to your dentistry. A lot of them are doing vitamin IV drips, ozone IVs, chelation therapies. When is the appropriate time for them to become chelated? You have a repertoire of all these different mercury-based fillings in there. When should the chelation start? During the process? That doesn't make much sense, okay? Once you clean that all up, and what kind of chelation things are you gently doing for them during the process? Do you have a protocol that when they're going to come in for their mercury filling removal, do they prepare themselves appropriately for the process? I learned that years ago. Without doing that, sometimes you just overload them, and it's too much, and their gut just becomes problematic. So we have them on some chlorellas and different elements, okay, to prepare them for the process itself, okay? They have to become their own best advocates, and I'll talk about that in a little bit. So you have to prepare them for the process itself. Good hydration, chlorella, certain chelation rinses during the process, and of course, what we do is we make a homeopathic remedy for them at the end of the process. We do what's called imprinting into a homeopathic. We collect a sample of each of those fillings, and we do a certain imprint into a water-based homeopathic to help them detoxify that specific type of mercury. But when you're doing heavy metals and stuff like that, you have to get the gut fixed. And that's important that's where we have a gut discussion. Okay, because you want to do, when you're dealing about heavy metals, whether you're doing chelation, whatever, the gut has to be functioning. Because this is how you want to eliminate the metals in your body. You don't want to pee them out through your kidneys. To me, it's like razor blades going through. A big popular thing for years was like DMSO, DMPS, IV, and the mercury's like just pouring out of this, but it goes through the freaking kidney. No, you want to crap it out, man. That's how you get it out. And remember, you're never going to get rid of all your mercury, okay? Let's be realistic, okay? But you want to keep it at a level that doesn't affect you physiologically or biochemically. Because you know what? You go outside, you just sucked some mercury in your head. But you want to keep those levels low. So also, not only go off too much of a tangent, how are you protecting yourself other than the mechanical stuff? Okay, let's be real. I mean, we do all this cool stuff with these precautions, but guess what? Bad news. You're still getting a bunch of mercury stuffed in your face and skin and everywhere else. You can't avoid it. So what are you doing about yourself? Okay? Well, every day we take chlorella. We do trace minerals every day. Take N-acetylcysteine. Okay? Selenium. From Marco Farmer, there's what's called Somaplex 21, which is all trace minerals. Because what happens is that your body, if it doesn't have what it needs, let's say a selenium or whatever the case may be, it will pick up a mercury molecule, it will pick up this. If you look at the periodic table, around all the basic elements we need are great, but if surrounding them are all toxic heavy metals. So your body thinks, in a mistake-wise, it will absorb these nasty things if you don't supply with what it needs. One of the greatest things for remineralization or just mineralization of your body is bone broth. That's great nutrition, man. Every day you should take a hit of that. Take some good clean bones and cook them up for 24 hours and take a hit of that every day. You have to learn to protect yourself, okay? Because those are the important things. A good chelating agent, N-acetylcysteine, chlorella, cilantro, charcoal has a certain level of toxic removals, but you need something with a sulfur group. That's what picks up the metals. Okay, that's important. Protect yourself, and of course your patient itself. And of course, understanding those protocols, and of course, once again, the protocols they're going through. You speak to their integrated practitioners, see what they're doing. Okay, and a lot of times you have to plug little holes in for specific care that you're giving. And also, understand them. Each of them are unique, and each of them have their own little story itself. So with all that understanding, I mean, why did they pick you? Why were you blessed with them? Okay, well, it could be that they looked you up as a member of IAOMT. IAOMT has great respect within the community itself. You're trained, okay, you're trained very well. You know, your word of mouth, okay. From them, that's always, you know, what we always practiced off word of mouth. We didn't get into that advertising. You know, you're board certified, whatever value that might be, it's important. And you're a nice person. We like you. You're very nice. That's great. It's always nice when a patient comes in, they're angry, they torture the front desk, they torture the assistants. You walk in, oh, hi, Dr. Mollica. Drives them crazy, okay? Or the patient, this is great. The patient will see the hygienist. I want Dr. Mollica to clean my teeth. I said, I don't clean teeth. Okay, well, I have to see him. Okay, I have to see him today. Okay, usually my wife handles that. Okay, I go in there. How you doing, Mrs. Ho? Oh, I just wanted to tell you about my garage. Oh, but you know what? It's part of the service, okay? Part of the service. And, you know, we believe in what we call sustainable relations. We really try to develop relationships with our patients. You know, they can go to any damn clinic they want to get a hole filled. But, you know, when they come to us, we get to know them on many levels, and that makes for a long-term relationship. Okay, we know about their family, their kids, their this and that. We've had patients for years now, okay? And that's worked out very well for us. But it takes time, and they don't mind paying you for your time. Remember, your time has value. Not everything is, procedure-based. Your time has value. So once again, why did they pick you? That could be any of those or none of the above. They just like you, and you got very lucky. That's for sure. So, once again, let's see which way did I go. I went backwards, right? Remember? As an Eagle Scout myself and president of the Northern New Jersey Council of Boy Scouts of America, be prepared. Okay, we like being prepared. So, be prepared to spend time and interview the patient. You can't come in, how you doing, but open your mouth. Okay? And charge them accordingly. Charge them $300 for an hour, $400, whatever. I know you could probably make more money on a Serac or something, but establish a relationship. And they want to tell you, guess what? Their story, man. Do you want the long version or short version of my story? And I'm like, well, whatever one you want to tell me. Okay? So, take the time to interview with the patient. These are all my experiences, okay? And be prepared to answer those questions on the sheet of paper. Did anybody get the sheet of paper with the questions written on them? That's always a popular one. My favorite is when you're done with the procedure and you say, thank you for coming today. It's been great. You walk out. I have one more question. Like, oh, one more question. You got to move quick these days. Otherwise, you get one more question. Did you hear about that herb? I was like, oh, my God. Okay. So, of course, and explain the details of your procedures. I think that's what we all do, or we try to do, or give them something written, because they're like, over their head. You didn't tell me that. Okay, I told you about 15 times. Oh, yes, I'll remind you again, okay? That's fine. And, once again, be prepared to understand the healing models they're in. And take the time to understand. They can educate you. I mean, a lot of people, they do a lot of homework. Now, putting it in the proper perspective is another issue. But they do a lot of homework, and this is where if you understand these different models, and you do, once you get into this world more and more, you can help them put the pieces a little bit more comfortably together, and they become a better understanding. And, be prepared to answer questions like, how do you feel about colonics? Like I said, I feel great about colonics, okay? And of course, taking some drainage remedies for the gut, et cetera. So we have these discussions that go on. I mean, it's very interesting. Some of the discussions that these patients have. They'll ground themselves with copper wires and all kinds of stuff. So I say, just go with it. Just go with it. And you can always charge them 50% more. It's okay for their time, okay? And of course, be prepared to question the patient on what they're doing, detoxing, herbals, homeopathics, I kind of said that, and specific alternative protocols. delve into that part. Because they're all doing kinds of different things, and they don't think it's important for you at times, even though you're a biologic dentist, but most of them are somewhat enlightened on that itself. Get me going backwards there. Okay. And they do their homework. They sure do, okay? They check you out before they visit. They check with all their pals, you know. The first visit, you know, they'll come in, check your office out. I mean, I've had patients come in and ask if they can do, you know, come in. No, man, no, man, yeah. You know, oh, the energy's good. We're good to go, okay? I mean, I have patients come in, you know, want to be the first patient on Monday, and they'll bring in, you know, these huge air cleaners. They'll plug them in. We'll go with it. We'll go with it. They turn them on. Boom, the whole neighborhood goes down. Okay, no problem. You go with it, okay? And, you know, once again, they, you know, look online, YouTube, all this kind of social crap that goes on. And then the quiz can come, you know, about this one, that. The quiz is always important. And, you know, sometimes they look kind of nutty, but not necessarily crazy. They're about as crazy as us doing this. And my best advice is, you know, just go with it and learn to have a great time with these patients, because they've turned me on to so many really cool things, different healing methods, different energy things, you know. And if you go, oh, that's crap, oh, man, that's a big mistake. Be open to it. It's amazing what you can learn through all these healing models that I've been exposed to, things I've never learned before. And I tell you what, it makes a significant difference itself. So it's actually makes dentistry a little different and a lot of fun. So once again, in summary, to some degree, the patient's experience, all about, you know, fun and being friendly, of course, being informative, and a health resource. Because if they start to dialogue with you about different models, different herbals, different, you know, homeopathics, and you can have an intelligent dialogue with them, that makes a significant. You just got about 10, 20, or 30 more patients coming into your office without doing a thing. You know, of course, we try to be on time, organized, neat, clean, classic stuff. And the most important thing is listen and learning. You know, because you'll hear the patients come in, no one listens to me. Okay, I'm listening to you, and they love it, okay? And respect for their time as respect, you know, for your time when they show up, okay? And show concerns for their issues, their pain, discomfort, their aesthetics, the biologic, okay? And communicate your goals, you know, what you're all about. These are all things you all should know anyhow, and how you can help them in a unique and different way, which you can, for all their medical and dental practices. And that's the key, is that you are unique. You're here learning different things. Your philosophy is different. Your thinking process is different. You know, you learn as you move along in this world as far as energy, okay, and resonating. You shift into this biologic world, to different resonance and different way of practicing. Your whole practice shifts, and then some kind of weird signal goes up, and here they come. All those patients come in, and they're great. They're really good. You're going to get the nuts. That's the way it is, you know. But the reality is it's much, much more different. So as we take the plunge into the biologic world, let's talk kind of biologic philosophy a little bit. So we're always seeking the truth, and this is why you guys are here. You're not happy with the traditional model, step block dentistry. You're looking for something more. You know, more enrichment into your practice yourself. Because remember, as you're helping these patients to heal, you're really helping yourself also at the same time. You are healing. By giving, you receive, okay? And three things, of course, cannot be long hidden: the sun, the moon, and, of course, the truth. And the truth, you know, through our truth, we find out about ourselves, you know, how our relationships go, professionally we operate, our wealth, our personal, and our perception of the world, how we perceive everything in the world. You know, I wake up in the morning and says, oh, thank God, I just woke up. Awesome, man. Now it's up to me. Because someday, guess what? You ain't waking up. It might be awesome or it could suck. Who the hell knows? I got to call the Long Island medium and be right back, okay? But, you know, like Billy Graham said, he says, you know, heaven is like one big happy family reunion. So you can imagine what hell is like. Think about that one. So, once again, how do I perceive the world? How do you feel? Even days, when you're all done this, you go to work, oh man, I feel like crap. But how do I feel? I feel great. How do you? I'm great. And you know what? You shift into that. Okay? And of course, it's nice to have friends with like minds, and that's what's important. You're all in here with friends. This is so different, this academy. I joined this academy, God, I don't know, 25 years ago or whatever it might be. It's like, visiting friends. We meet twice a year, but, you look forward to it. That's, the information's great, but you see your friends, and share your experiences. And that's what's very unique about this group, is the sharing, caring aspect and the family sense that you have. And that's really, for me, is very, very important. So we talk about, core principles, okay, of the integrative dental biologic medicine. We talk about some principles. How do we define ourselves, and how do we get in, look a little bit differently into things? The principles of empiricism, integration of cellular and tissue ecology, relationships, integrative biologic, dentist-patient reciprocity, spontaneity of oxidation, spontaneity of healing, and of course, spiritual surrender. My glasses on. I have to surrender my eyeballs. Okay, so let's talk about that. So empiricism was the standard of medicine for many, many years. Homeopathy, medicine in general, was really about observational skills. A lot of physicians, don't even look at you in that certain models. They'll look at lab tests and say, okay, this is what you need, versus looking at you empirically, okay? And it's a scientific, discipline that concerns itself with the purity of clinical observation. It's amazing if you look at a patient and you truly look. You look at their eyes. Are their eyes cloudy? Are they aware of what's going on? Their skin, how they function, how they move. That's empiricism, but you learn a great deal from those observational skills. So in integrative biologic dental medicine, empiricism recognizes the absence of experimental validation. Not everything can be explained experimentally. There's so much more to the reality of human life and function itself. So yet we don't doubt the validity of what you see, okay? And that really applies for a number of things. Clinical association mostly preceded, establishment of experimental evidence. For examples, what Donalitum, B12, they never knew how B12 worked. Now we do. Even ozone, homeopathy, we understand how these things work through science. But initially we saw observationally how the patients respond to these things, and then experiments caught up with that. So don't deny your observations and your empirical look. Your science is beautiful, technology is great, but don't forget that the human contact aspect itself. So you also talk about these principles, once again, of integration. So this requires that you integrate the care of the patient that is safe and effective without subservience to one or more schools of medical dental thought. All that really means is that, once again, I hit that point, you're open to all different schools. Sometimes the patient needs osteopathic care, chiropractic care, once again, Chinese medicine, allopathic medicine, homeopathy, naturopathy. Understand these different models, and I tell you what, some patients come in, I've tried everything. Nothing works. Have you tried this? No, and maybe that's the key that make them heal and get better itself. So what's really important also is, and develop and understand synergistic and complementary therapies, protocols. I mean, that's really the key when you talk about these holistic or integrated protocols, that all the things that you're doing health-wise, all these herbals or these IV protocols, all this nutritional thing, is bringing the patient in the same direction. They're all moving, they're synergistically together, that they're working together, not against each other. It's like taking echinacea golden seal. They just neutralize each other out. Okay? So understanding those things where things are synergistically supporting the body itself. Of course, efficacy is based on the integrated protocols in its entirety, not the individual therapy. And that's what's important also, that it's just not a thing. You know, we teach a lot of ozone things, which is unbelievable, fantastic, but that's a piece of the puzzle. There's other components you fit in, and then you really get a full healing process itself. And of course, the principle of integrity of cellular and tissue ecologic relationships. What that principle is really basically you're an ecosystem. You got to keep your ecosystem well balanced. You know, keep the water nice and clean. Keep all those bugs nice and happy, okay? All the tissues communicating and talking to each other. And that's really clearly important. We're going to talk about that in a few minutes. But it's important that your body communicates with itself in a clear, coherent fashion. Okay, we love epithelial cells. Why do we love epithelial cells as dentists? We love epithelial cells. Well, look at the mouth. It's filled with what? Epithelial cells. They're great. They're kind of dumb, but they need to be told what to do. And we're going to discuss, you know, what we have to tell them, because if they're told the wrong thing, they do very weird things that you don't want to know about. Okay? But it's all about ecology, keeping your ecology, being able to detoxify your body. How do we get rid of stuff, by the way? How do you get rid of things? Well, you poop it out, right? Pee it out, sweat it out, and what? Breathe it out. So all these pathways have to be open. When all these people start to detoxify and all this kind of stuff, they better be pooping and peeing real well and doing some sweating. Okay? That's how you clean the garbage can, the body at times, okay? Because remember, when we talk about ecology, you are what? A superorganism. You're super. You know, 90% of you is microbes and 10% mammal. We have an intimate relationship with those microbes. You know, when you're happy, oh, I feel great, oh, I'm so happy. Ooh, oh, man, my sexual desire is going berserk. Your serotonin's working well. Where does serotonin come from? The gut flora, okay? How do I digest food? Through the bacteria. How are the bacteria producing all kinds of vitamins, B's, K's, all that stuff? Because they're functioning well. So you have a symbiotic relationship to maintain that commensal bacteria. Like I said before, we've been doing everything to kill the damn thing. Environmentally, it's trying to kill us. So we nurture that. Why do you take probiotics all the time? To keep fluorinating, keep challenging your immune system. Because where does your immune system live, by the way? In the gut. Along that small intestine, large intestine. Right, lined right up against that intestinal wall is your immune system. The difference between the outside world and the inside world is one epithelial cell. That's it. One epithelial cell. You know that. Okay? That breaks down, you're open into a whole environmental issue. So we love to nurture those microbes, especially down the gut, the skin, the lungs. They even find microbes in the cranial vault now that are producing wonderful chemicals. Okay? And like I said, we've done a good job trying to kill it over the last years. And the problem that we've had is that a lot of our ancient microbes that we've carried for multiplicity of generations, we've lost some of those things. And that's why we see a lot of gut issues today. Especially we put these kids on antibiotics, all these different type of drugs. Not good. So a friend of mine, well, Mike would know this also, Dr. Ali, our mentor at the school, he was like the father of integrated medicine. And, really he built things on ecosystems, okay? The first thing you fix in the natural world, or integrated world, you have to fix the gut. Get the gut up and functioning, whether it's probiotics, colonics, whatever the case may be, nutritionals. You get the gut fixed, which starts at the oral cavity. We know where it ends. And the other systems tend to fall in line. Because if you're putting peeing right, the immune system is up and regulating, it's going to reflect into the blood, to the liver, all the other higher systems as well. So you go to a naturopath, 10 minutes for the break? Okay, good. We, once again, start to fix that gut, and everything else starts to work its way up through the chain itself. And it's, once again, if you have a toxic oral cavity, how the hell is this really going to work itself? So, once again, the integrated protocols, okay, as you understand them, support and balance the ecology of the patients. So now we're thinking differently. We're thinking biologically and ecologically. Teachers, treating the patient ecologically and biologically, creating ecology in the oral cavity that's conducive to health and wellness, okay? And of course, once again, is our relationship with the patient itself. And that's important. Where, the tendency in these patients that come in that have these cancers and really chronic diseases, it's very, the ones where I've seen the successes is when the ones that took their own best advocate. In other words, they took responsibility. They took, their, boots by the horn to pull it up, pull their bootstraps up, and did the work. The ones that surrendered, per se, oh, just fix me, didn't work. So they're an integral part of wellness, and your relationship with that patient of getting health and wellness in the oral cavity, in their head and neck and their whole body is critical, but developing that relationship that will help them as part of the team. Okay, that's where the successes come from. An intuitive mind. Intuitive mind. This is something, I love what, Albert Einstein said, the intuitive mind is a sacred gift. It's a gift every one of you have. You have a good intuition. That's why you're here. And the rational mind is the faithful servant. And we send, unfortunately, we create a society that honors the servant has forgotten the gift. We're so in tune with that, that rational mind that we forget that wonderful, that intuitive component itself. So an integrated biologic dentist supports and helps eliminate barriers to wellness. So our job is to recognize those barriers in the head and neck, recognize in general, have a sense of that, those barriers that are holding back that patient. And more and more integrated practitioners, physicians, chiropractors, whatever the case may be, that are enlightened, are recognizing if we don't fix this up on multiple levels, they're only going to get partial results from the rest. Why does this patient just not getting better? It gets to a certain point, then they regress. Very important regress. Wow, we cleaned this up. Wow, what a change, and we all have seen that before. Once again, the patient must be its own best advocate and take responsibility for their own health and wellness. That's critically important. That's where I've seen patients pull out from the abyss and return back. And that comes in many, many levels. And which is interesting is the principle and the spontaneity of oxidation. Now, what is oxidation? Well, oxidation is really like a metabolic byproduct of our metabolism. Okay, it's spontaneous. It's kept in balance by our antioxidants that are taken nutritionally. But we always love that the cells themselves, your own cells, produce antioxidants. That's the critical thing. That's the ultimate goal. That's the brass ring in health and wellness. When you take 1,000, 2,000, 5,000, whatever, 50 grams of vitamin C, remember, that one vitamin C molecule quenches one oxidant, free radical. It's a 1-to-1 ratio. Where if your cells produce antioxidant, catalase, superoxidant, mutase, all that, it quenches millions of them. But it quenches it in the sense that if you're in wellness state, you're healthy, whatever that might mean, okay? You're balanced, homeostasis. It's a balance between oxidation and antioxidants. They balance each other. Now, things start to shift, become more toxic, heavy metal, whatever the case may be, you start that slippery slope. This is when that imbalance occurs, and you become more oxidatively dependent, and you start that slippery oxidative slope where you're seeing more and more cell damage. So oxidation, at the pathogenic core, is the pathogenic core of cellular and molecular aging and disease. It's built into the system. Now, all free radicals are not bad. It's information also. But once again, if it's kept in check by your naturally occurring antioxidants and your nutritional supplementation, your body functions well. So we need them. It's part of the process. But it's also information so your body couldn't respond appropriately. And we see that in periodontal disease. Man, we see that uncontrolled oxidation at time, you know? And that oxidation, we see the vascular beds collapse, the lymphatics collapse itself. You see congestion, okay? And influences the local ecology. But that local ecology, as it shifts and drops down, on the right, this is where, you know, that's New Jersey water drinking that. So that does it to you. But anyhow, but once again, these are, you know, this local event has far-reaching ecological implications throughout the whole system itself. So when you get into that part where the patient is in the degenerative state, domination by oxidation, you can see that in them. You have uncontrolled oxidative injury. You see the collapse of the vascular beds, the congestion in the tissue, especially periodontal disease, and what's called anaerobiosis, because we're not using oxygen properly. The metabolism has shifted. We're shifting into a fermentation state, and that's what you don't want to do. Okay, when your metabolism goes from an oxygen-based metabolism, you're functioning great. You're producing, you know, 36 ATP, oh, I'm feeling good. And then all of a sudden, you know, time creeps up on you. Heavy metals, chemicals, solvents, environments, whatever the case may be, emotional stuff, you start to wear down. You could possibly shift into a fermentative state. We start to burn what? Sugar. And that's a dirty, dirty way to get metabolism energy, because you're only producing maybe 2 ATP, and then your oxidative ratio goes way up. That's where you see these chronic cancer patients fall into that fermentative state. And we see that even in perio, you know. You have oxygen, which we love. It's important. We're oxygen-based, all right? Not all life was oxygen-based years ago, but oxygen-based is a life giver, life taker, you know. As a life giver, you know, pulls energy out of food, oxygen-based metabolism. But as a result, once again, you get that production of those radicals, okay, those free radicals in the system, reactive oxygen species. But in a healthy environment, it's well balanced out. It's well balanced out with the natural occurring antioxidant systems and, of course, what we take nutritionally itself. So you look at this concept that Otto Warburg, years ago, okay, 2-time Nobel Prize winner, talked about the origins of cancer. It's about oxygen metabolism, okay? So when you think about it, it's an altered pathologic, you know, state of oxygen metabolism. It's a fermentation process, an uncontrolled oxidative injury. And we see that in periodontal disease. If it progressed to the point where we see all that tissue change. So our job is to change that ecology, restore all the body's natural innate healing processes, and allow for the spontaneity of healing. You know, it's amazing. We think about healing. We talk about healing, you know, and healing we know goes on many levels, okay? Healing physically, mentally, emotionally, spiritually. That's all part of the healing process, we call it. But, you know, think about something as simple as you cut your finger. How the hell does that know how to heal perfectly? Think about that intelligence behind it to organize that simple healing process. It goes. Amazing, amazing thing. But it's built into our genetics. It's built into our system. Is it energetic? Is it physiologic? Biochemical, structural? It's a combination of all things that allow us to heal from a simple cut to dramatic illnesses. You can reverse and heal. And what we like to see is you become a dental healer. And that's a different way of thinking. You're not just a mechanic, but you're helping heal the patient, and you can heal yourself. How are we doing on time? Now? 2 minutes left? Okay. Good. So patients, you know, they have the innate capacity, given the proper support, to heal themselves. So the essential code is built in to the injured tissue. It's woven in, and then once again, given the proper opportunity, the proper nutrition, proper support, the patient can heal themselves. So we talk about energetics. You know, we are really an energy being trapped in the little meat suit right here. Okay, we're crystal structure. So the spontaneity of healing, you know, it's really about life. Now, how do we function? I mean, it's amazing how we function so well. You know, we can walk, we can talk, all kinds of things. You know, we have to work at light speed. Life is based on the movement of what? Electrons. This is how life works, functions, movement of electrons. So that innate intelligence somehow directs that electron movement, okay, which is energy movement throughout the body, or chi, whatever you want to call it, that electron movement. But things can become, what we call dysregulated when the electrons start to fly off through all different toxicities of the environment and creating structural and mechanical disarray. And of course, that's where we see that oxidative injury itself. But the body does have that capacity through auto re-regulation, and this is where we have to work back to, okay, electron reorganization into a structural coherent function. So we'll take a break right there. We will take a break, and then we will discuss the mystery of life and healing.